I am sure a lot of folks have had a chance to hear some of the conversations that have been unfolding over the course of the day, and they've set us up so beautifully for this next panel, which is the promise and peril of social media. I'm just briefly going to mention that I am the Associate Director of the Center for Digital Health, and I'm an associate professor at Brown Medical School. I'm a clinical psychologist by training, and my research interests are focused on the interplay of physiological, so this could be tech things like, smart sensors and watches and things like that, as well as things like genomics, and then social context, which I have studied both in terms of thinking about auditory social context and laboratory designed kind of paradigms, but also thinking relevant to today's conversation about social media. And my work has been federally funded over the course of the past decade or so. A lot of the work that I've done related to social media has actually been collaborations with members of the CDH leadership, including Dr. Rainey, Dr. Jeff Wang, other folks who are affiliated with our Center for Digital Health, including Charlene Colaby and Christy Rizzo. So I've learned a ton from these amazing colleagues. So anything that I say that's impressive, you should attribute to them. So I'll stop talking about myself, and I want to have a chance to introduce the amazing speakers that we have today. I'm really pleased to get to introduce Munmun Choudhury, who is the Associate Professor of Interactive Computing at Georgia Tech. She really, I think, brings such a different perspective to the way that the conversations that we're having, and I think leads really nicely from the conversations we've had around machine learning and unsupervised approaches and learning and clustering. And so I know she'll probably have something to say about that at some point. She is was one of the founders of understanding computational techniques that allow us to better understand the social media as they're unfolding in the larger public senses, as well as interpersonally. She's really been focused, consistent in a way, I think, with our center, very much on the responsible use of these technologies and on ethical uses. Her work has been highly interdisciplinary, again, consistent with our center, and she's incorporated social computing, machine learning, natural language analysis, and has been awarded more awards than I'm going to mention, and recently a prestigious Rising Star Award. Her work has been covered in tons of popular press like New York Times, NPR, BBC, you name it. And her work has really, I think, shaped the field in a lot of ways that some of us maybe don't even always fully appreciate. I also want to mention Dr. Sherry Pagoto, who is a licensed clinical psychologist at UConn. She's the professor of allied health sciences and is the director of the UConn Center for Health and Social Media. She's also the past president of the Society for Behavioral Medicine, which is one of the leading organizations in behavioral medicine field as a whole. And her work has incorporated development of an evaluation of health communication related to social media delivery. Her work has involved obesity, cancer prevention, COVID-19 vaccine uptake, you name it. She's that broad framework of behavioral medicine, I think, has been really a space where she's defined a lot of the field. She's had federal funding for almost 2 decades now, published hundreds of papers in peer-reviewed journals, and also is really devoted to the science communication piece, having contributed to Washington Post, USA Today, US News and World Report, and so on. So I'll stop talking about the amazingness that they both bring to this conversation. I'm gonna ask actually now if we can have poll number 6. And then while folks are filling that out, I would love to just let Drs. Pagoto and Choudhury go ahead and say, anything else that you have to add around your introduction, some of the work that you've been doing that might have been relevant to conversations that came up earlier today, or might just be things that you wanted to make sure got mentioned over the course of this next half hour.
I'm happy to go first. So in terms of, I can elaborate a little bit on the type of work that I'm doing, and I'll be really excited to hear what other people are doing as well, and always open to collaborations if what I talk about is of interest. So my work is generally focused on ways we can use social media to improve public health. Obviously, we've been witness to how misinformation on social media has hindered our ability to get COVID under control. And that's just one example of how misinformation has negatively impacted public health. But I really see kind of the flip side of the coin, in the same way that connecting people online can have these negative impacts on health, it can have positive impacts. And that's something that I've been looking into for the past few years, are what are ways that patients are using social media that are really adding to their recovery or helping them prevent chronic disease and so on. And so I really think it sort of depends on how people are connecting on social media, what information they're sharing, where are they getting that information, what spaces are they connecting in, and who is present in those spaces. And it's been my long-term belief that there's been kind of an unfulfilled role for healthcare professionals and public health professionals in interfacing with patients, or the public as it may be, on social media. So I'll give a couple of examples of the work that we're doing. One example, in our center, we developed a behavioral weight loss program that's actually based on the diabetes prevention program, lifestyle intervention, that's entirely for delivery on Facebook in private groups. And so it took us a lot of years to kind of iterate and figure out, how do you make this program, which was developed for a clinic, come alive in a Facebook group. So we've been kind of optimizing it over time. And the reason we use Facebook for weight loss is because if you develop an app or an online platform somewhere else, you have a not small hurdle of getting people to use that technology, to use your app or to go to your online platform. And so that's one hurdle. And then you have the hurdle of, designing it well. So when it comes to something like Facebook, that's not a problem. 70% of adults are already there. The average user is going on several times a day, spending probably more time than we care to think about on Facebook. There are already patient communities there. Healthcare providers have communities there. But interestingly, those two groups of patients and providers, and I'm in both types of groups, they aren't technically or typically in the same spaces on Facebook when it comes to health. And so I'm really trying to bridge this gap by creating these spaces as a healthcare professional for patients, so that they're getting the kind of information and assistance that we know is evidence-based. And so I also do a fair amount of research on health communication on social media, looking at ways we can develop messaging on various health topics, like Nicole had mentioned, whether it's vaccine hesitancy or cancer prevention, particularly focused on people who may not be motivated to change. And so it's one thing to do a weight loss program and you put out an ad and you get lots of responses and lots of people want to lose weight. But when it comes to a topic like vaccine hesitancy, you can't put out an ad and say, hey, do you want to become less vaccine hesitant? And people will come running. So it's not necessarily a topic where people will come to you. And so you have to think about ways to get the message to the people. And so what we've been doing there is creating communities or finding communities that attract a certain target audience and embed messages within those communities. And so the community itself is on a topic that resonates with the target audience. And we use what I call embedded messaging strategy, whereas you take some messages that we develop some evidence for that they can change attitudes and behavior and kind of embed them into a feed, into a community that is really resonating with the values and interests of that target population. And so for this approach, we often are targeting parents. And so we're either creating or finding communities of parents where we can kind of educate them about these topics. And so that's just like a little sampler of the type of work that we're doing, but I'll stop there and hear a little bit about what Dr. Choudhury is doing.
All right. Hi, everybody. Dr. Nugent, thank you for the kind introduction. And I can spend a couple minutes to talk about the work that I'm doing. And it actually very nicely complements what Dr. Pagoto just said about the potential and risks of social media in being used as a way for us to intervene and support public health broadly and mental health in particular. So to start with, I'm by training a computer scientist, but over the last 10 plus years, I've been very excited and interested in how computing can be used for the service of the broader societal good, and mental health is one of those topics that I'm deeply passionate about. So my work at the lab that I lead at Georgia Tech, we are very interdisciplinary, something that Dr. Nugent also mentioned. We are very interested in developing sort of computational techniques and the technologies which could be powered by these techniques to kind of thinking about how social media can be used in the service of, quantifying, understanding, and hopefully eventually improving sort of mental health outcomes. So to tell you a bit about the motivation of this work, one of the biggest motivations is sort of the gap that we see in sort of mental health right now, which centers around measurement and stigma. So because of these reasons, people are often not connected with care in a timely fashion. And also even when they're connected with care, the management and the treatment process can be difficult sometimes because many people still experience, persistent symptoms, even with an ongoing care. So luckily or unluckily, people are using social media platforms, right? And many people are already bringing social media in their conversations with their clinicians. People are looking to social media to engage in, candid disclosures of various kinds of stigmatizing, otherwise less shared topics, and mental health is one of those topics. So what we have been doing is to look at those digital traces that people leave behind on these platforms and think about sort of two kinds of questions. And the first kind of question is around early detection, and we are interested in how these types of data can be used to sort of understand or identify early warning signs or forecast risk around mental illness before, let's say, people might be connected with care, or before they might be having an adverse event, and how do we do those kinds of things in an ethical and responsible way. And then the second kind of question, which is, given that people are on these platforms already, how can we think of these platforms as instruments for interventions, as instruments for connecting them with care, formal or informal, that otherwise that they may not have access to. So to give you some highlights of the work that we have been doing around early detection, which is sort of the first question I posed. So we have been very successful in kind of looking at different mental health concerns, different social media platforms, different populations, and so on. And we have been finding that there are various kinds of linguistic signals, as well as signals of social interaction that can be gleaned from people's social media feeds, that can allow us to both identify these early warning signs, but also identify markers that could be potentially clinically meaningful for intervention and to influence and inform clinical decision making. And a lot of this work that we are doing is in partnership with clinicians and, of course, the people with lived experience as well. And then we have also been kind of been able to expand that in other contexts, let's say for situated communities. So for instance, thinking about how can college campuses or workplaces deal with challenges of mental illness that kind of impacts groups of people together, and what would it mean to think about interventions that support groups of vulnerable people. And this could be both in terms of times of normalcy as well as times of crisis. We are living going through a crisis at the moment, which is the COVID-19 pandemic, and you can think about how situated communities could better cope with the challenges that come with these crises better, and how can we learn better about those challenges to cope with by looking to social media feeds of people. And then thirdly, we are also interested in kind of broader questions of public health, population level insights. So here, a lot of our work has been sort of in collaboration with the Centers for Disease Control and Prevention around thinking about how suicide surveillance efforts and interventions could be better informed by looking at what is going on social media, and how importantly social media could be one source of signals that could work together complementary with other kinds of public health signals that are already being harnessed for surveillance of different mental health concerns at the population level. And then the second question around sort of thinking about social media interventions, a lot of our work has found that to a lot of people, social media could be a way to seek help that they might find challenging to access through formal or more structured means, such as visiting their primary care doctor or visiting a psychiatrist seeking therapy, even picking up the phone and calling the 800 lifeline number. People are turning to social media as a way to cope with these challenges. So there is a tremendous opportunity to thinking about how can we make these online spaces safer and more welcoming for people, where they can have those conversations. And importantly, given that there is all sorts of stuff on the internet, including these online communities, Dr. Pagoto pointed out the issue of misinformation. An important question there is, not just how do we make these online spaces safer for disclosures and discussions of mental health, but also how can we ensure that if social media turns out to be an important mechanism or an intervention that supports people, how do we ensure that they actually deliver credible information to people and not information that could harm individuals? So on that note, I would like to pause here. I'm looking forward to more discussions around some of the polls that you guys filled out.
Ooh, you got you took the words right out of my mouth. Yeah, let's find out. Okay, the latest of the poll results. So, one of the things when we thought about what poll we wanted to ask was, how do we think about the way that many people think about this, right? And the way that this poll is worded, really, I think comes back to the way a lot of times you'll hear talked about in media or in regular conversations is you go to your pediatrician's office, oh, here's how much you should limit your kids' social media use, or you should do these different things. And I think one of the things that can be a little bit tricky is figuring out how to make the most of social media. So one of the things that I heard you both say is that you've seen it as a tool that you can leverage in ways that make observable positive impacts on the world. So we sort of you both have done such a beautiful job, I think, of moving beyond the sort of like, is it bad? Is it good? And probably everybody attending this also gets that nuance, because that's why you decided to show up. But I think what the finding sort of this poll, even of these really tech savvy colleagues, is this idea that in general, we think it might be kind of bad, that it might be, or at least we often find ourselves thinking more about the parts of it that are bad. And that brings me actually to the other question that we have for our poll today, which is our next poll, number 7. No, wait, is that right? Yeah. Thank you. Perfect. And, part of how, when we were talking previously, myself and Dr. Pagoto and Dr. Choudhury, we were sort of talking about also why are people choosing to get on social media? And you both have alluded to this a little bit, but I want to give you some time to talk a little more about your thoughts.
Sure. I think people start off on social media to connect with family and friends, and then they discover there's a lot more there, and then it sort of balloons because you can connect with people with all different kinds of interests. And so, and it depends on your platform too. Some platforms people might get entertainment from, some platforms people may get news from, other platforms might be their artistic expression. I'm thinking of people that I know on Instagram, and that's where their photography is. Or so I think once you dive into social media, you discover, you know, oh, wow, there's this whole landscape of things to do here. And so whatever your inclinations are, you will probably find something along those lines. And so if you really believe vaccines are dangerous, you're going to probably find a community that will agree with you. If you, you know, have type 2 diabetes and would really like to connect with other people who have type 2 diabetes, you will find that. Or if you're really into running or whatever it is that you're into. And so I think where people start and where they end up is probably a little bit different. And it probably also depends on your age and platform and all kinds of different things. And so, I mean, I think social media in some ways is a mirror of, you know, what we're doing on there mirrors our interests and our values. And so I don't know that it necessarily is the cause of all of these bad things that we talk about, but it's rather gives us an opportunity to pursue interest in information that may be good or bad. Now, I guess where it can get us into trouble is that information can travel very fast and very widely. And then that's where a lot of damage can be done. But so, yeah, I mean, I think it's sort of all of the above, I guess I would say. So maybe it's a little bit of a trick question.
Yeah, I totally agree. I mean, you know, initially the scholarship in social media from, I guess, 15 plus years ago kind of started noting that people get there because they want to bond with their existing social connections, you know, and maintain those connections. And, you know, some of the early work is around when people move away to different cities, you know, as life moves on, and social media is a way for them to stay connected with, you know, their social connections who are now geographically apart. But now I think over the years, and we didn't quite see this coming, is this idea of bridging social capital, what the literature says, which is the idea of seeking out and forming new connections, knowing that these probably are people I'm never going to meet in person ever, but still there is a connection either based on interest, either based on motivations, value systems, beliefs, and so on. So that way, you know, social media is a great place. But the what complicates the use of these social platforms is a number of things. But one thing primarily I would note are the fact that these platforms operate or are regulated by, you know, AI and algorithms. So what you get to see on these platforms may not be a true reflection of what is happening in the real world. So people get stuck in echo chambers. They find these interest communities. They find these communities they agree with, and that you know, brings them happiness, brings them satisfaction. But at the same time, it can be challenging because of the way these platforms function. It is easy to think that this is the reality in that bubble, but that may not necessarily be the case. I think, you know, we have an entire generation of people now who are not thinking about these issues, though, who have grown up with social media being around them. So it is just a natural extension, or I would say a natural counterpart of in-person interaction. It's just another way that this generation is growing up to socialize with others.
I think you bring up a really important point. And while we're talking, maybe we can show the last poll results. Because I realized that all of a sudden, as I expected, the time is upon us that we're almost done. But you know, one of the things that these poll results are consistent with what you both just talked about, is this idea of connecting is so critical when we think about social media. Something else that you both touched on is this idea of these sort of sub communities that develop in social media, and also that we understand these things differently as a function of those communities, which are influenced by those algorithms, but also as a function of age. And I know, unfortunately, we don't have as much time as I always wish we could to keep talking. But one of the things that we had talked about before, I know, was the hope that we would kind of end on this idea of how do we learn from our communities. And I'm going to give you each just like a moment to say something briefly about that. And then I'm going to say that this is the perfect stage to set for the next, just after we hear welcome from Dean Jha, we're going to have a panel on engaging community voices. So it's going to be okay. We'll cover this topic.
Yeah, so, I think one of the best examples of this is the Survivor Corps community of COVID long haulers. Some researchers partnered with this community, and they're producing some incredible research about long haul COVID. And that is just like a brilliant model for what we could be doing for all kinds of chronic or infectious diseases, because there are already patient communities, at least that size, pretty much on every health related topic. And so one thing I know that we had talked about as we were discussing this panel was how do we sort of create those partnerships? I think they have a good model that we can kind of springboard from, but I think there would be some amazing research opportunities if we come up with a way to understand and partner with existing patient communities and take a very CBPR, community-based participatory research approach, by letting them lead in terms of coming up with the research questions that they would like to participate in answering, as opposed to kind of, what we've done wrong with CBPR in the past with community organizations, which is a sort of barge in. We want to recruit, we want to study you, we want to do all this, we want to fly in and then fly out. So I see that there are parallels with online communities where we need to figure out how to approach them and how to meet their needs and how to create partnerships that are respectful and mutually beneficial.
So a couple of things that we can learn from these online communities that can help our understanding of mental health. So first of all, I would note there have been many lessons that we all have learned during this pandemic. One of which that stands out is how to maintain social connections even when you have to quarantine and be alone at your homes. And social media platforms have played a tremendous role on that front, especially if we talk about people who are challenged by mental health concerns, whether it is just connecting with friends or family who they cannot meet for years, or accessing telemedicine, teletherapy. I think these platforms have shown us a great potential, and I think this is a hugely beneficial lesson for us as we think about scaling up mental health access, as we think about preparedness for other crisis events. Sadly, COVID-19 is not the last pandemic it seems like that we are going to see. And I guess the second learning lesson that we have from these communities is aligned with what Dr. Pagoto was saying around sort of involving these individuals as a part of this research. So one of the things that we see, COVID long hauler communities as a great example. There are plenty of other examples that we can learn from, one of which are, these communities where people go to seek help on their recovery efforts around substance misuse. And there are lots of important and interesting things that happen in these communities, new kinds of harm reduction approaches, new kinds of, strategies that people are adopting to, refine their recovery efforts in conjunction with, what formally they are being suggested by clinicians. So I think, there's a lot of opportunities to learn from what is going on in there, both to correct people if things are harmful, but also if things can be potentially useful. These are tremendous opportunities for a community-based participatory approaches to invest in, alternative approaches that can support people with their struggles around mental and behavioral health.
I love how you've ended on a positive note. So thank you. So this is the perfect time for us to go ahead and introduce Dean Jha. I'll say also stick around because we'll have more conversations about community voices shortly. So
thank you, Dr. Nugent.
Thank you.
Thank you.
Hi, everybody. My name is Ashish Jha, and I am the Dean of the Public Health School at Brown. And I am so pleased to be able to welcome you to this great conference, Digital Health for a Post-Pandemic World. Now, we've all been distracted by the pandemic for the last year, and it makes sense. It's the biggest health crisis of a century. But as we begin to pull out of this pandemic, as we begin to get this pandemic under control here in the United States, it's time for us to remember all of the other challenges of public health, the endemic diseases that continue to plague us here and around the world, the epidemics that we were facing before COVID-19 arrived on our shores, the epidemic of mental illness and mental health challenges, the epidemic of the opioid substance abuse disorders, the epidemic of racism and how that shapes our society. There are fundamentally important issues to be working on. And when we think about working on these big public health challenges, we have to remember that there is a whole new set of tools available to us that we've never had before. And that's what I think is so exciting about this conference and about the work being done by Dr. Megan Ranney at the Center for Digital Health, is that digital health tools give us a whole new window into how we identify problems and how we begin to solve them. And this isn't just about data gathered in the cloud somewhere where you're running some analyses. This is really about the shoe leather epidemiology and the shoe leather public health, but done through smartphones and done through sensors and done through other technologies. This is how we are going to capture data. This is how we're going to learn to understand people's lived experiences. This is how we're going to capture the fundamental parts and essences of the things that make up public health. So I'm excited about this conference. I'm excited about the work that is going on. I believe this is fundamental to how we're going to tackle and solve the big public health problems in the years and decades to come. And I'm thrilled that all of you are part of this, and I am thrilled to be a part of it as well. Thanks so much.